Hello, everyone. My name is Thomas Chai. I'm from People's Republic of China, and I'm a person living with HIV for more than 20 years now. I was diagnosed in year 2000, and by that time, there was limited access to ARV. We don't know anything about the CD4 or viral, and the only thing facing us is the death. And why I've been struggling and joining the advocacy campaigns for treatment access, and then I turned myself into a NGO person for the last 2 decades. And I would like to talk about the undetectable viral equal to untransmittable. What is meaning for us as a community of people living with HIV. First of all, I heard about U equal to U. By that time, I was very inspiring. I think that you might asking me why it's so inspiring. It's because the people living with HIV, they're living in the stigma and discrimination. They try to escape from the reality. They can't face the illness because people are scared of us. We were rejected to a lot of opportunities, including life-saving opportunities. So why U equal to U is so important to us? First, from the health perspective, it's a strong evidence to support our demand for equal access to medical care and services other than ART. During the past one or two decades, in many countries, people living with HIV can only go to one hospital, the HIV clinics, because other than that, they might be rejected. And from surgical service or any other relevant services, because they were told that our blood might pollute it and might cause infection for the others. And even our show up in the hospital seems not welcome. And I remember that the differences was understanding and belief. I remember in 2004, I had a tuberculosis, TB of spine, and then I had a surgery, and finally I had a wound. Needs to change dressing almost every day, and by that time, I went to the TB hospital in Guangzhou City, and then after a while, they told me that you have to, because you're HIV positive, you have to go to the infectious disease hospital. And then I have to taking a taxi and go to the hospital, which are not close to my family. And then I have to go every day. And one time, the same year, I was, by one opportunity, I traveled to the US. And then I was in the Harvard University attending a meeting. So during the meeting, I need to change dressing as well. I talked to a doctor from US, and he said that, oh, no problem. Let me go to the pharmacy, get a pack of kit, and I will do it for you in the hotel room. So that made me feel very warm and friendly and supportive. And also, I have my high school classmates who are living in US. When they heard that I was in Harvard University, they drove from New York City to Boston to meet me. And then we had dinner together. They even invited me to their home to eat with their family. I asked them why. You know that I'm HIV positive. They said, we all heard about that, but we know that it's not transmittable through the dining together, shaking hands, and talking to each other. So this is like that was one very inspiring moment when I heard that the people understand that I can be a friend with them, even I'm HIV positive. So with this evidence, we can further reduce the stigma and discrimination from the field, from the healthcare sector. Also, it's a strong message to the health policy and budget makers that HIV treatment and care is also most important strategy for HIV prevention. And during my last 2 decades work in HIV, I work with the Ministry of Health, government policymaker, and also the health budget developers. And their concern is the treatment. Oh, costs too much. And these people, lifelong treatment, well, the hole is big to be filled. And then people say, some people come and say, let's focus on prevention. We should spend more money on prevention to prevent more HIV cases. So with the U equal to U, we can say that now HIV treatment is also a powerful strategy for HIV prevention, because only when the people getting the undetectable viral load is equal to untransmittable. It should be well funded and optimized consistently. So the treatment for people living with HIV should be optimized with the current resources and also increasing on it. Undetectable is not only for the others, but it's also essential demand for our own well-being. At the same time, undetectable, the people say, oh, some of the community might have some misinterpretation, say, people want us to take in the medicine, just want us to have undetectable viral, and so that we could not transmit to the others. So this is something we need to highlight, that patient education is critical, because only undetectable viral, which means our immune system could be restructured and our health can be secured. And then U equal to U also important for our career. Many people, after they getting the HIV positive, they have to withdraw from their workplace, like a government employee. I also heard about students who request to leave the school because they're HIV positive. And also recently, we also heard a lot of people say that, complaining that people living with HIV cannot work in the restaurant, can't work in the hotel, and can't run any business relating to food and services. So U equal to U should be another advocacy tool for us to fighting for our rights, to getting a job, getting our business. We should be able to travel to all countries for business without restrictions as well. And then, so I think our life has been limited by HIV positive, and U equal to U is a liberation for our future. Another part is about the acceptance. The barriers created by fear will be lifted. Our life should become more diversified and blessed. In the past, a lot of people, they worry about they will be rejected if they disclose about their HIV status. Even in many countries, in my country, HIV treatment is well covered by the health insurance, but people dare not to use it. They worry about if they're using the health insurance, their HIV status might be exposed to the others. They might be isolated, rejected from the current friend circle. So U equal to U could make the people have more acceptance to the people living with HIV. And also our self-acceptance should be greatly improved and become more confident to obtain a better life and live. And with the HIV treatment popular and getting advanced year by year, living with HIV is not a big issue at all. For the life expectancy, there are not much differences as long as with good compliance and monitoring. But a lot of discussion in the PL-HIV community, one thing is, I just want me to be negative, no matter how much I pay. I say, what is the big difference? You want to escape from only one pill a day? And they say, no, I just can't walk out of the shadow of positive. So, and I think U equal to you is another strong post for our life, can make ourselves to be walk out of the darkness, to be more confident, because when we have undetectable viral, and our life should be the same as the others, we are not transmittable to the others. Lastly, I would like to share the story of Nico. Nico was a little girl. She was abandoned in front of a hospital in Guangzhou City when she was only about 3 months old. And what happened was my colleagues found her and then brought her into the hospital. She was quite sick, quite weak, and finally she was diagnosed as HIV positive. And after 3 months of treatment, and she needs to be taken care. Instead of sending her to the orphanage, I decided to adopt her. When I'm making this decision, I was very struggling. I have some discussion with my wife. She said that living with HIV was so difficult, so challenging. And then, but I say, she was born and she's innocent. And actually, I believe that in her generation, as the knowledge and the people's awareness increasing, HIV shouldn't be a big barrier anymore. And especially everybody should understanding U equal to you, and she should be able to grow up with the equal opportunity like the others. And then I also believe that in her generation, she could grow up healthy and then getting married and have her own child free from HIV. And I believe that she deserves a life in full. So we adopt her. Now she's 6 years old. She's very happy and healthy. Thank you.